It is Thursday, and you know what that means? It means we are back with another episode. Now, in case you're here for the first time, subscribe and like this video. Be sure to leave any comment. So today I've come to talk about some of the key sexual and reproductive health tips to take you through the year 2025. The year has just started. We are still in January, and we have a long way to go, about 11 months and a few days to end the year. And there are some things that you must observe in case you want to go through this year successfully and in good health. And today, being a sexual reproductive health specialist or expert, I want to talk about some of the tips to take you through the year 2025. Now, the first tip that I want to talk about is think about your goals for this year 2025. What are your goals? For example, are you intending to actually get pregnant or to make someone pregnant? Are you intending to have a baby at the end of the year? Or are you intending to have a baby next year that you will conceive in the middle of the year? Just have your goals laid out straight. And in case you're not intending to maybe have a pregnancy, have a baby, how are you going to avoid that pregnancy? So that means you need to set your goals straight and know what is going to help you. What do I need to use? Should I go for contraception? Should I abstain? Think about anything that is going to work for you in this year. And this also comes handy with the screening for any STIs, those are sexually transmitted infections, checking for HIV. Just be intentional about what you want your 2025 to look like. And that brings me to point number 2, which is talk to your partner. If you're someone who is dating, someone who is married, someone who has a partner, please, you need to have a discussion. You need to have these discussions about your sexual and reproductive health. You need to have discussions about what your goals are. In case you're not feeling comfortable about something, you need to open up, In case you feel like you should screen for an STI, you need to discuss with your partner, because at the end of the day, it comes back to both of you. For example, if one person goes and checks for an STI and they have it, if the partner is not involved, however much we treat this person, we shall be wasting time. We need to treat both of you as a couple. So you need to have these conversations and make sure that you lay out your goals. This relates to having your goals laid out straightforward. Please practice safe sex in 2025. We do not want to hear stories like, I didn't know what I was doing. We do not want to hear stories like, I made a mistake. There is no mistake that we want to hear in 2025. Practice safe sex. In case you're going to have sex with someone whose status you do not know, make sure that you do use a condom. Okay? There are many more things that we have to screen out for apart from HIV. There are other sexually transmitted infections you have to look out for, hepatitis B, and in case you're intending to get pregnant or to make someone pregnant, things like sickle cell screening. We need to be very intentional and know that we prioritize our health. Don't let those 2 minutes, those 3 minutes, those 5 minutes, or 30 minutes of having fun ruin your life forever, okay? So make sure that you only engage with people whom you're sure about, whose status that you know, and in case you don't know someone's status, be very intentional to use protection and protect your life and of course your loved ones. Keep a healthy lifestyle, and I'll repeat this, just have a healthy lifestyle in 2025. In case you've been smoking, please stop. I see quite a number of young people doing a lot of shisha. You walk into a club or a band, you're like, what's really happening here? Are we in some kind of a smoking competition, So if you've been smoking, it is high time you stopped smoking. In case you've been drinking, you need to cut down or reduce on the alcohol content that you're taking in. We need to mind what we eat, okay? Be very intentional about your diet. This affects your overall health, but also it affects your sexual reproductive health. And even if you want to just talk about sexual performance, it definitely affects it, okay? And we need to do exercise as much as possible. Exercise is very key in very many things, preventing chronic illnesses like hypertension, diabetes that come with obesity, but also it improves your overall health as well as your sexual reproductive health generally, but also in terms of performance, in terms of fertility, in terms of just your general well-being. So make sure that you live a healthy lifestyle. And this, I will combine it with mental health, because stress is one of the things that lead people making mistakes, or what we call mistakes. I've seen people who come in, they made what we call mistakes. Maybe someone slept with another person, and this was out of stress. Maybe she was disappointed, he was disappointed, and was looking for someone to comfort them, did something without rational thinking. So we need to be very intentional about what we do, and we need to prioritize our mental health. In case you're stressed, in case you're depressed and you need to talk to someone, please make sure that you talk to someone very, very professional, someone that is going to give you the actual information that you need to know, someone that is going to actually help you live a positive life. Let's get accurate information from accurate sources. Quite a number of times we get information from our friends, from our colleagues, from the internet, from our parents in the villages, information that is unverified, information that is not correct. So whenever you have any concern in regards to your sexual and reproductive health, make sure that you visit a qualified practitioner, someone is going to give you the accurate information that you need to know in order to make an informed decision. That will save us from making the mistakes, that will save us from not going for services which would have gone for, but because of the stigma and the myths that we've heard about them, we think everything is true and we end up neglecting what would have helped us, and choose or make decisions that are actually leading us to the wrong side of the picture. Okay, so there's a lot of information on the internet, but most of that information is unverified, most of it is false, it is misleading, and it is wrong. Make sure that you have a discussion with a qualified provider, with a qualified practitioner, and have accurate information. Make sound decisions. Okay, you should not have your decision making influenced by anyone. Remember, every decision that you make affects you as a person. So learn when to say no, know when to say yes to something, know what are the implications of the decisions that you are making, and make sure that you make the rational, make the correct, make the right decision. Do not make decisions when you're high, do not make decisions when you're excited, do not make decisions when you're angry about something. Just make sure that whatever decision that you're making, you're not going to regret it at the end of the day. Okay, so even if someone is your guy and you love him so much, but is forcing you into doing something that you're not really comfortable with, please do not succumb to the pressure. For example, let me say you have a guy that you love so much and you want some sexual practices that you've not been doing. Maybe someone wants, for example, anal sex, and you're not comfortable with it. Do not just accept just because you want to make someone happy. Do something that you yourself will actually be happy about, and you won't have any regrets at the end of the day. And lastly but not the least, make sure to schedule routine wellness checkups with a qualified provider. You do not need to be sick for you to go to a health worker. You do not need to be sick for you to see an expert. Okay, just do make this a routine to schedule those wellness checkups. Just go check, see if you're still fertile. Just go, if you're a lady, have that ultrasound scan done, just to make sure that your organs are okay, the uterus, ovaries, tubes, and everything. If you're a guy, just go have that routine semen analysis to see if your sperms are okay. Just go have the blood pressure checked, just go check for diabetes, go have that CBC done. Just have that routine checkup, have your weight measured and your height, know your BMI. It will help you to keep in shape, and it will help you to know in case something wrong is going on silently, you're able to capture it early before it has any serious implications on your life, on your general health. Okay, so make sure that you schedule those appointments, and in case you want to have a chat with me, the number will be there on the screen. Make sure to tap in, reach out, and we can have a discussion. Bonus tip: always remember to pray. Always remember to pray. I'll be back on Sunday with another episode, and we shall be discussing quite a lot still in this field of sexual reproductive health. So make sure to subscribe, make sure to like this video, and thank you for watching up to the end. Make sure to leave a comment about what you think are the key tips that we must observe in 2025 in regards to our sexual and reproductive health. See you soon. I sign out, Dr. Rogers.